Welcome back, everyone. We actually have some fantastic news for seniors in today's video. This is as new provisions are kicking in, and it will actually lower specific prices for the elderly. So this is great to hear, and finally some good news that we can report on this channel for you folks. So if you are excited about that, make sure you go ahead and give this video a tremendous thumbs up, smash the like button. I would appreciate that. If you haven't already, of course, make sure you are subscribed and have notifications turned on. That will let you know every time we post a brand new video or go live like we did in our last video. And just for my help and your sake, guys, what do you like better? Do you like the pre-recorded videos or do you like the live ones? This will help me so I could structure my channel better for you guys and assist you to the best of my ability. So let me know down below in the comment section if you do prefer the live videos or the pre-recorded. That will just help me out. So what exactly is going on? What is this good news? Well, the fact is that senior citizens and other Medicare enrollees will now finally see a break in the cost of their insulin. Now they won't pay more than $35 a month for each insulin prescription that's covered by their Medicare Part D plan, and they won't be subject to a deductible for insulin. Now, how on earth is this possible? Well, it's due to several drug-related provisions in the Inflation Reduction Act, and they're kicking in this year, 2023. Congress passed this law last summer, and it aims to make life a little bit easier for Americans, specifically the elderly, when it comes to medications. And there's actually other measures taking effect in 2023 that will also help out seniors. Some of these laws include getting more vaccines at no charge and also penalizing drug makers for raising drug prices higher than inflation. So for Medicare enrollees who take insulin via a pump, which is covered by Part B, the $35 a month cap will actually start taking effect on July 1st. Of course, insulin was discovered more than a century ago, and it's relatively inexpensive to manufacture, but in recent years, the prices have soared, and that has taken a toll on millions and millions of Americans. In fact, this alone has contributed to about 1.3 million Americans with diabetes, or 1 in 6 insulin users, rationing their insulin in the past year, according to research published in the journal Annals of Internal Medicine in October. And skipping the medication can lead to death. And believe it or not, this new provision is the first ever cost-sharing limit for insulin ever enacted at the federal level. Now, some 22 states, as well as the District of Columbia, have placed on caps ranging from $25 to $100 on insulin supplies and devices. But they only pertain to insurance plans regulated by the state, so it excludes a lot of people. So the $35 cap on insulin is expected to translate into major savings for senior citizens. According to the Centers for Medicare and Medicaid Services, some 3.3 million Medicare Part D enrollees use insulin in the year of 2020 alone. And according to a study by the Kaiser Family Foundation, Part D insulin users paid $54 per prescription on average across all insulin products in 2020. And that's 39% more than they did in 2007. Now, the analysis did not include those who receive low-income subsidies. So in total, enrollees shelled out just over $1 billion on insulin in 2020. That's more than quadruple the amount that they spent in 2007. According to Stacy Duzadzina, who is the professor of health policy at Vanderbilt University, she had said, quote, "This is going to be quite a bit of savings for people, especially for people who use insulin consistently throughout the year or who use other drugs and who might find themselves in the coverage gap. In the coverage gap, Part D enrollees are responsible for 25% of the cost of drugs after their total spending on medication exceeds exactly $4,660 in the year of 2023. Now, there are limitations to this monthly cap, and there are some caveats that some Part D insulin users do need to know. The $35 monthly cap applies to each prescription of insulin. So for those that take 2 types, for instance, they could end up paying up to $70 a month for their medications. Part D plans also have until the end of March to update their systems to reflect the new $35 monthly cap. So enrollees might unfortunately end up being charged a higher amount until then, So you'll just have to remain patient and wait it out. But insurers must reimburse them within 30 days for any amount paid above the cap. In addition, plans are not required to cover all insulin products. So enrollees should be sure that their policies cover the insulin that their doctors prescribe to them. Now, CMS is offering a special enrollment period this year to allow any insulin users to switch their plans if needed. And the law does not cover non-insulin related medications such as Trulicity, which many diabetics do use to control the disease. Now, advocates do say that other provisions of this law, which are taking effect in the coming years, will ultimately allow seniors to afford these medications. Now, among the biggest drawbacks is the fact that the $35 monthly cap only applies to Medicare enrollees. Democrats had wanted to broaden the provision to cover the commercial market as well, but it had to be narrowed after a challenge by GOP senators prevented the more comprehensive measure from being included in the package. Some lawmakers are already calling for Congress to take up legislation to widen the cap's scope. And according to the Centers for Disease Control and Prevention, more than 37 million adults in the US do have diabetes, but 1 in 5 don't know it. And thanks to the Inflation Reduction Act, there are other provisions in the bill that do help seniors in a positive way. This is just the gist when it comes to that $35 monthly cap for insulin, but we'll absolutely be sure to cover other benefits that are covered under the Inflation Reduction Act that are kicking in this year for you folks. So I hope you enjoyed this video. Hopefully this clarified some things for you. Be sure to share this video with a friend, a coworker, someone that you think might benefit from this information. Be sure to share it on social media or whatever platforms you like to use. Also, make sure you go ahead and smash the like button. I would appreciate that. And if you haven't already, of course, make sure you are subscribed and have notifications turned on. If you want to get some free stocks, all on me, all free, use the brokerage links down below in the description of this video. Sign up with the brokerage platforms, Robinhood and or Webull. You'll get some free stocks, some valued to thousands of dollars in some cases. So let us know what stocks you get. And if you want to connect me on social media, go ahead and use the social links down below in the description. Go ahead and connect me on Instagram, Facebook, TikTok. All those links are down below. I look forward to seeing you guys in the next one. Take care for now.